All right, tonight we are discussing sarcoidosis and fatigue. This has been a topic that has been requested many, many times, so we're super excited to have Dr. Harris here to talk about it. My name is Abigail Mangum. I am the project coordinator at Life and Breath, and Life and Breath was established 26 years ago now, when in memory of Ida Hall, Sean Hall's mother, and he wanted to build a foundation that provides support to the sarcoidosis patients. His mom had a very complicated journey, like a lot of you do, and really struggled to find support. So we are here to support sarcoidosis community, to provide a nurturing environment for those affected with sarcoidosis, and to build more awareness in the medical community. We have this monthly speaker series that we do once a month with sarcoidosis experts, and it's geared toward patient education. We have a Life and Breath Scholar program where we're working on educating and raising awareness within the physician community, primarily resident physicians, but hoping to help build future sarcoidosis experts. We have patient support from sarcoidosis experts. We have some patients that we support through scholarships and education. I don't know if you know Josh Polito, who is working toward trying to run a half Ironman triathlon. And then we also have the My Life and Breath Planner, and I'll post a link for that in the chat in just a minute. And that is a book built by patients and sarcoidosis experts as kind of a roadmap for following through the sarcoidosis journey. Tonight, our speaker is Dr. Richard Harris. Dr. Harris is on our board as well as our clinical advisory board and has worked with Life and Breath longer than I have. So he's been there the whole time I have, and he's been an amazing support for us. Dr. Harris knows that striving for great health and wellness is crucial to living a higher quality of life. As a successful internal medicine physician and pharmacist, Dr. Harris has the critical expertise to help you achieve your best health. Dr. Harris is a double doc. He received his Doctor of Pharmacy from the University of Texas and his medical degree from the McGovern School of Medicine. I know he has several businesses, successful businesses, combining holistic lifestyle and more traditional medicine. So we're super excited to have him here tonight. We do need to read a disclaimer. This webinar will not give medical advice. No doctor-patient relationship has been established by talking with Dr. Harris during this meeting. Our speaker does not know your medical background and therefore cannot give you any specific medical advice. Speak with your doctor before acting on any of the information you hear this evening. So Dr. Harris, welcome. Thank you for joining us tonight again.
Yeah, thanks for having me back on this Life and Breath webinar series. Okay, I'm going to get Zoom is there. We go. All right, I'm gonna get my presentation up and going. And all right, does that look okay? Yep. Okay, perfect. All right, so what we're going to be talking about today is fatigue, and we have a lot to cover. I'm going to try not to go too fast, but there's a lot of information I wanted to give to you. My background, I've been a physician and a pharmacist. I'm more on the holistic side because I really do know how the medications work being a pharmacist. And I really know that the most important aspect for our health in numerous conditions, preventing disease or treating disease, can be related to our lifestyle. Our lifestyle can either help or hurt things. So, this is our agenda today. First thing we're going to do is talk about definition and diagnosis. So there are multiple different things to fatigue. This is sort of a all-encompassing term, and it can mean many different things to many different people. So part of fatigue is inability to initiate activity. It may be reduced capacity to maintain activity, or there's a emotional component to it. So there's difficulty with concentration, memory, or emotional stability. The prevalence when they surveyed people saying, hey, have you had fatigue in the last 2 weeks, was about 40% of people say they had fatigue in the last 2 weeks. If you look at chronic fatigue, it's about 6% or so of the population with chronic fatigue. And there are numerous things that can cause fatigue. And then we can break fatigue down into two categories, acute and chronic. So acute fatigue is often due to a recent life stressor. This is something like you got the flu or COVID or something very traumatic happened in your life and you're recovering from that. And then we have subacute and chronic fatigue. And subacute and chronic fatigue are due to medical conditions, often things like rheumatological conditions, autoimmune conditions, infectious disease. They can be due to medication, substance abuse, um, cardiac, lung, endocrine, cancer. So all of these chronic conditions can be associated with fatigue, and we'll get into more the reasons for that later. Now, the signs and symptoms can help you identify the underlying cause. For example, if a patient says that I have disrupted sleep and snoring, then we would want to investigate sleep apnea as a cause of their fatigue. And we can look at other factors as well. So if the onset is abrupt or gradual, that may make us look at two different things if it comes on suddenly or if they've been gradually getting more fatigued over time. Is it stable? Is the fatigue staying about the same? Is it improving? Is it worsening? Does it kind of wax and wane? There's different reasons for that type of symptom course. What's the duration? Is it something that's lasting for 30 minutes? Is it lasting 2 hours? Is it happening after you do XYZ? Is it happening after you go to the gym or go to the grocery store or climb a mountain? When is the fatigue happening? How long is it lasting? And is there a pattern associated with it? And is there an impact on daily life? That's the important thing. Like, how much is this impacting what you want to do on a daily basis or what you have to do? So part of what we do is a physical exam, right? We need to look at certain things that may point us in the direction of what's the underlying cause, because more often than not, treating fatigue is about treating the underlying cause. Now, if it's, let's say we see someone with edema, fluid in their lower extremities. Well, now I'm thinking, okay, this might be cardiac, this might be liver, this might be kidney. If I'm doing my exam and I feel that they have an enlarged thyroid, maybe I'm thinking hypothyroidism or hyper, too little thyroid hormone, too much thyroid hormone might be a reason for someone to have fatigue. So it kind of helps me narrow in on the process that underlies this. And of course, if you have more than one disease state, though all of them could be contributing to fatigue. And so you have to approach it in a very systematic fashion. So let's talk about labs, right? What do we think about when we're looking and trying to get to the root cause of fatigue? Well, one of the reasons, and it's very common, is anemia. And anemia, which is low red blood cells. Red blood cells are very important because they're needed to carry oxygen throughout our body, and we need oxygen for metabolism when we're just kind of in our normal everyday activities. That's why we breathe. But anemia is can be multifactorial, and it can be a singular cause or it can be multiple causes contributing to it. So first thing we're going to order is that CBC, that complete blood count. And what we're looking for there is we're looking at the hematocrit. That's the portion of the blood that's liquid. We're looking at the hemoglobin. That's the actual part of the red blood cell that carries oxygen. And we're looking at the RBC count because that's going to give us some information on what's going on in the blood. And then we can order follow-up labs. Some common causes of anemia are iron deficiency. We see this a lot in people who are vegan because most of our sources of iron, our high quality sources of iron, are meat. We see this a lot in people who have absorption issues, malabsorption, gastric bypass. People who are on certain medications can have issues absorbing these nutrients. So we'll run an iron panel looking for, do you have iron deficiency? B12 and folate are common causes of anemia. If your thyroid is underactive, that can cause anemia. A sneaky one is copper. Copper deficiencies can cause anemia. So these are some of the labs we may look at when we're trying to determine, do you have anemia? And of course, the treatment for that would be, well, if it's due to one of these particular vitamins or minerals, we just replace that vitamin or mineral. We want to look at insulin sensitivity. So about 40% of the population is insulin resistant. This is insulin resistance is the root cause of diabetes. It means that we have trouble processing our blood sugar and then our blood sugar elevates. Proper glucose metabolism is necessary to meet demand and supply. So if I'm doing something that requires energy. And so my body has to utilize the energy it has, whether that's from food I have in my system or body fat or stored sugar to do so. And so, what can create fatigue is if you have a demand that exceeds the supply that's available. And this often happens in insulin resistance. So people who are diabetic or pre-diabetic often have fatigue. And so what we want to look at here is we want to look at multiple factors related to your insulin sensitivity. Hemoglobin A1C. Fasting insulin is kind of the canary in the coal mine. Fasting insulin will start to increase before some of the other markers, before A1C, before fasting glucose. So if that's elevated, that's a key sign that you're having some insulin resistance. And then look at fasting glucose. And so the mainstay of treating insulin resistance, there are medications for this, but the lifestyle and the lifestyle things that we talk about later are all going to be things that can help with insulin resistance. Adrenal function. So we want to look at two things with adrenal function. We want to look at cortisol and we want to look at something called DHEA. DHEA is an androgen. DHEA is a precursor to other sex hormones like testosterone and estrogen. And low levels of DHEA have been associated with other autoimmune conditions like MS. I should have started off that there's not a whole lot of data, as we've talked about before, in sarcoidosis. So a lot of what I'm talking about is pulling from other autoimmune conditions or other conditions that they've studied where people had fatigue and the results that were given. Now, because most of this is lifestyle recommendations, these are things that we should implement if we're not already doing. So DHEA is important for blood vessel function, for muscle mass, for mood, bone density, and like I said, it's a precursor to other hormones. So you want to measure that. We want to measure DHEAS. I should have put that DHEA sulfate. That's the major form in us humans. And if that's low, that's a simple over-the-counter supplement that we can use. And we've seen, I put studies down there below, and I put these in there because I'm evidence-based. So if someone's talking about stuff and they don't link evidence and they don't link human studies, then that's probably not a reliable source of information. So I'm going to give you the studies that back up what I'm saying. And so DHEA has been studied in chronic fatigue syndrome and also in Addison's disease, which is a adrenal disorder where you don't make enough adrenal hormones. And people saw improvement in mood and fatigue when supplementing DHEA in these conditions. Cortisol is the major stress hormone. The job of cortisol is to help our body go through stressful situations. Cortisol has a diurnal rhythm, so cortisol is highest in the morning. That makes sense to get us ready for the day, encounter the stressors of the day. It decreases throughout the day in an ultradian fashion. So I think it's about every 90 minutes we have little cortisol spikes, and that's just to help our body deal with the things that go on throughout the day. If our cortisol levels are too high, that can cause some issues with glucose metabolism and energy utilization. It can also cause some changes with where we store body fat. That's usually due to stress. So if we're chronically stressed, our cortisol levels can be too high for what we need them to be. And so there are different things that you can do for that. A lot of the things we're going to talk about as far as a lifestyle will help if your cortisol or your stress levels are too high. You want to check out the thyroid. The thyroid is very important for making thyroid hormone, and T3, more so T3 and T4, are very important for various aspects of our metabolism. So, when you check the thyroid, the screening labs are TSH and free T4. And if those are abnormal, we may do a deeper dive into the thyroid. Now, a lot of times, what can throw off the thyroid is if we don't have adequate selenium intake, if our vitamin D is low. Selenium is very, very important for the thyroid, for protecting the thyroid from free radicals. If we don't intake enough iodine, so this is can be an issue for people who use mainly like Himalayan rock salt and Celtic sea salt because they aren't iodinized. Iodine was added to table salt by the U.S. government because people weren't intaking enough iodine in their diets. So, and that's something you can check in the urine. So that might be a subsequent test if the screening tests are abnormal. And then you may look at T3, you may look at thyroid antibodies. There's a whole different workup if those tests are abnormal. The good news is if your thyroid is underperforming or overperforming, there are medications that we can take to help with that. Inflammation. So the common pathway in fatigue for all of these states mostly deals with inflammation. Now, a lot of these states can also cause issues with how we process energy. So, glucose metabolism, fatty acid metabolism, protein metabolism. Inflammation can also cause issues with those things as well. So, you want to check some markers of inflammation. High sensitivity CRP is one that is checked often. ESR is another one. And I'm sure your doctors have probably ordered these and maybe followed them to measure inflammation levels. There are so many different inflammatory pathways that one of the things that I will do if I can is look at the final common thing with inflammation. So, excess chronic inflammation damages tissue. And we can look at markers of that tissue damage. 8-OHDG and lipid peroxides are final markers of tissue damage due to oxidative stress, due to inflammation. So, that's something that some labs can order, and you can look at that. And because some people will have high inflammation and their CRP and the ESR are normal. There are some other inflammatory labs that some doctors, rheumatologists and things may order as well to look at other inflammatory pathways. But the 8-OHDG and the lipid peroxides, those are something that you can use to measure the final common pathways of inflammation. Vitamin D. Vitamin D is a very important hormone. It is not a vitamin, it's actually a hormone. And vitamin D is responsible for calcium metabolism. We had a whole talk on vitamin D before in sarcoidosis. There are some caveats there with sarcoid because the granulomas can actually make the enzyme that converts the inactive form of vitamin D to the active form. That's usually done in our kidneys. But so some people can have high or low vitamin D that we measure in the blood, the 25 vitamin D, but you measure the 125 vitamin D, which is the active form, and it's high. And so before you even take vitamin D, you want to make sure you check a PTH, a 25 vitamin D, and a 125 vitamin D, and a calcium, right? So those are very important. But low vitamin D is associated with fatigue. And so we have human trials. So the first one is a double blind randomized controlled trial, gold standard trial on self perceived fatigue. And it showed improvement in healthy people when they supplemented vitamin D. And the other one is a meta analysis. A meta analysis is a test or a study of studies that aggregates data. And this was in multiple sclerosis. MS has some unique links to vitamin D. So what they found is that people in MS, when they supplemented with vitamin D, they did show improvements in fatigue. Sex
Dr.
hormones.
Harris, can I
Yes.
interrupt really quickly? Can you talk a little bit more about vitamin D and sarcoidosis? I know this is a question we get a lot, and it's
Mm-hmm.
connected with, I think, hypercalcemia. And I know you sort of touched on it, but could you again just kind of refresh the connection?
Yeah. So the sarcoidosis is a granulomatous disease. The process is inflammation creates these granulomas in certain organs, and in that can be different for every person. We classically think about it with the lungs, but sarcoid can affect various different organs and systems in the body. Now, what can happen is these granulomas can make the particular activator for vitamin D, the enzyme that activates it. And so you can have elevated calcium levels because what one of the jobs that vitamin D does is it increases calcium absorption through the gut. And so we can see in some people with sarcoidosis that they have hypercalcemia, in which case it's usually not a good idea to supplement vitamin D in that scenario. And so you need to do a deeper dive to figure this out. You need to measure calcium. You need to measure PTH. PTH is kind of the antagonistic hormone to vitamin D. PTH tells our body to get rid of calcium, where vitamin D tells our body to store calcium. And so if your PTH levels are normal or low, that's a good sign that your vitamin D is either good or maybe too high. If your PTH is, sorry, it's the opposite. If your PTH is high, that's an indication that your vitamin D levels maybe it's a little bit too elevated, right? Because you're having too much calcium, and the PTH is trying to get rid of that calcium, right? So these are all things that just measure and take into account.
Okay, so pretty much every sarcoidosis patient needs to do more research into whether they should take vitamin D or not.
Right. That before you start taking it, you need to have these labs measured for
Okay.
sure. Because it normally for most people, vitamin D is essentially harmless. You know, the risk of adverse effects is small. So, um, but that's one of the things that I recommend that we check. Vitamin D is part of my routine screening that I recommend for everybody, considering the 42% of the population has vitamin D insufficiency. So, it is very, very common.
Thank you.
Okay.
That's
You're welcome. Sex hormones. So, estradiol, testosterone, progesterone, these are kind of the big three. Testosterone is the one that we mostly think about for men. Testosterone is also very important for women. It's actually women's testosterone levels are higher than their estradiol and progesterone levels. It's just the way the units are done makes it seem like it's lower, but testosterone is very important for women as well. These all of these things, these sex hormones can change mood for sure. They have other roles, but when they're abnormal or low, they can cause fatigue. And we see this in studies on HRT studies, right? Sometimes what can happen is when we have an increase in the inflammatory markers and cytokines and things like that, they can be associated with a decrease in sex hormones. And there is some literature showing that in patients with sarcoid, it is associated with lower testosterone levels. But about replacing testosterone and outcomes in sarcoid, there really isn't data on that. But these are things to check as well. I think a lot of people are afraid on the female side for HRT because of the women's health study. We now have a lot of evidence showing that around the menopause and symptoms of menopause can be devastating for women. That HRT can offer benefit. In fact, the recent study which came out showing that HRT and estradiol therapy can reduce the risk of breast cancer. But it's all about selecting the right patient in that regard. And not being afraid of hormone replacement if it's done correctly. It's something we do a lot of at Nimbus. Okay. So, one of the things I'm really, really big on is do not just depend on your doctor to give you all the answers. We cannot. We only see you for like 7 to 10 minutes, right? You have to be able to self monitor. You have to figure out how you interact with your environment, right? It's like your finances. You wouldn't just go to your financial planner and say, here's my bank account, here's access to it, do whatever you want, right? No, you're going to come in there with some ideas, with things that you want to do, with goals, and you guys work together. You should have the same relationship with your physician. So there are a couple of assessments here for fatigue. This is the fatigue assessment scale, and what I recommend is if you're someone who's having fatigue, periodically just do these. And we created the planner so people can track things and figure out how certain things interact. So what you can do is if you're doing this, periodically, and you all of a sudden hit a really big bout of fatigue, you can go back and look and be like, man, what did I do in the last week? Maybe I did something different or outside of my schedule, right? And then you look back and say, okay, maybe it was this activity. Let me see if this happens again if I do that activity into the same degree. And so you can keep track of your fatigue. This particular scale tracks fatigue severity. So it would be good at seeing how fatigued you are after you do certain activities. And then you can come up with a plan about how can I better manage myself when I have to do those activities. This scale is called the fatigue severity scale. This is another scale that basically looks at how fatigue is affecting your life. So this scale would be useful when you are doing specific treatments. So you can see as you go through a treatment, is the fatigue improving in how my life is going around, right? Like, am I better able to do my activities because of this XYZ, this treatment or modality or something else? And see, because if you just rely on subjective, meaning how you feel, it's really hard to put a gauge on that. But this now it actually makes you think about it and put it on paper and track. And so I'm really, really big on self monitoring and tracking things over time, because now you can figure out what works for you and figure out maybe things that you should avoid. Okay. We're going to talk about lifestyle interventions here. I don't think I need to tell you that exercise is good for you. I think pretty much everyone on the planet knows that, except only about a quarter of adults are meeting the recommended exercise time. I know with with an autoimmune disease, it can be difficult to exercise. And that's why we have to do, a lot of times, graded exercise programs. So that doesn't mean you need to go and do Mr. Olympia. For those who don't know, Mr. Olympia, it's like a bodybuilding competition. You don't have to go and do that workout. Maybe it's, okay, I'm going to start with a 2-minute walk every single day. And you do that for a week or 2 weeks. And then it's, okay, I feel a little bit better. Maybe I'm going to do 2.5 minutes. Maybe I'm 2 weeks, 3 minutes, 4 minutes, 5 minutes, because that slow, steady progress over a year, you do that for a year and you might be up to 30-minute walk every single day, right? So graded, start slow and have a realistic appraisal. Whenever I talk to people about starting to work out, ask yourself, what can I realistically do? And if it's, you've got 30 minutes 3 times a week, perfect. You start with that and then you build a plan up from there. Now, I'll get more into the recommendations here, but I want to talk about research. So, this was a study in chronic fatigue patients. They were randomized to exercise or cognitive behavioral therapy. And what they found was that both interventions decreased scores on a fatigue scale with no significant difference between the two. And half of the patients saw clinically significant improvement in their fatigue. If I had a medication that worked on 50% of the patients that I gave it to, I'd be a trillionaire on a private island, right? That would be astronomical numbers. That if 50% of the patients I gave a medication to saw clinical improvement, that means my number needed to treat is 2. I treat 2 patients, one of them's going to improve. That doesn't exist in pharmacology to that degree, right? And so these are based upon principles of graded exercise. So I highly suggest working with a trainer or a therapist, a physiotherapist, somebody who is familiar with people with autoimmune conditions and can help you develop a graded exercise program. Now let's look at another study. This one was a study in people who actually had chronic diseases. So it was a meta-analysis. So this is a study of studies, and it's people with chronic medical conditions. And it showed that physical activity interventions moderately reduce fatigue. And they use this FSS scale that we just talked about. People saw the benefits, reduce fatigue in a time period as little as 2 weeks. As little as 2 weeks, right? So a lot of times people don't intervene on lifestyle stuff because they're like, oh, it just takes too long. But these changes can occur pretty quickly. They saw the biggest effect sizes when people did like aerobic cycling. I love biking. I think biking is a great activity for numerous reasons. It's great for your cardiovascular system. It's low impact. It also takes you back to fun childhood memories, right? Most of us have pretty fond associations with riding a bike because it reminds us of when we were young and we were carefree and we could just bike around the neighborhood and bike to the park and hang out with our friends, right? So here's what I tell people when they say they don't like something. A lot of influencers will be like, only do the exercises that you like. And what I say to that is, you're an adult. We're not toddlers. You don't get to just do what you like to do. Sometimes you have to do what you want to do. I don't like paying taxes. I have to pay taxes, right? So sometimes if you don't like any aerobic activity, you just have to pick one and try to do it for a max of 30 minutes twice a week, right? I hate doing cardio. There's nothing about cardio I find enjoyable. Cardio is a slog to me. I love lifting weights. I could lift weights for hours every single day and I would be happy. I still do 30 minutes of cardio twice a week. I'm not happy to do it. I don't want to get out of bed and do it. I don't nothing. I'm not motivated to do cardio except for swimming. I do love swimming. Our pool has too much chlorine in it now for me to go and swim. That's the only form of cardio that I enjoy. But I still get out there and I still do it just because it aligns with my goals. I do not let my feelings distract me from my goals, right? And I think that's part of having the correct mindset. Um, so strength training also had a large effect size on reducing fatigue. I think everybody should be doing some form of strength training. I know that I'm not expecting you guys to go out and bench press 500 pounds, but if you can just start maybe with some body weight activities, maybe it's some yoga or resistance bands are great, right? Resistance bands, I travel with them. If I can't get to the gym, I'll do some resistance bands activities. And there are workouts on YouTube and everything that you can pull up to just start doing something. And what's really, really great is that we have now shown recently that exercise snacks. So let's say you did 31-minute workouts throughout the day are just as beneficial, maybe even slightly more beneficial for some outcomes than a 1 30-minute session. That's incredible. So even if you say, I don't have 30 minutes to continuously work out, but if you can find 2 minutes here, 3 minutes there, 4 minutes there in your schedule, heck, you can even do it while watching Netflix. I've had patients like say, well, I started riding the bike at my house while I was watching Netflix, watching my favorite show. And they would only ride the bike or they would only watch their favorite show when they rode the bike, right? So there's a whole bunch of tips and tricks that you can do here. Again, if you're gonna work out 3 days a week, I would do 2 days of cardio or 2 days of weights, 1 day of cardio. Ideally, at a minimum, I like to see people do 2 days of weights, 2 days of cardio a week. Start low and go slow, right? Um, the guidelines recommend 150 minutes a week of moderate intensity exercise. That's things like walking, gardening, cycling at a low speed, and then 75 minutes a week of vigorous exercise. What's funny is that people often say, well, I'm too fatigued to exercise, but I'm like, exercise actually helps with fatigue, right? It's going to suck when you first start doing it. It's going to feel awful. Don't push it too hard, right? Just go low, slow, graded, right? Maybe if you can only do one push up a day, start with that. And then you'll build up strength and build up tolerance, right? So the name of the game in chronic conditions with exercise is low and slow. And just realizing that even if it's a couple minutes a day, that's beneficial. Okay. Sunlight. Love me some sun exposure. I get plenty. We've got a dog. I walk him around outside. But there are people who say we have a deficit in sun exposure, that we just spend all day indoors all the time. This was a study looking at multiple sclerosis, so another autoimmune condition, and they looked at sun exposure And they thought the effect would be due to vitamin D. So people who got more sun exposure, more vitamin D, because we make vitamin D out in the sun, and that would be the pathway for less fatigue. It wasn't. The vitamin D was not the associative reason. So what they found was that personal sunlight had an inverse, so meaning more sun, less depression, less fatigue. And they thought that the mechanism could be due to the production of anti-inflammatory cytokines that we do when we're exposed to sunlight, or it could be the effect of aligning with circadian rhythms. This was another study looking at people with depression. So people with fatigue often report a more depressive symptoms, more depressive mood. And what they found was decreased sun exposure was associated with a 36% increased chance of cognitive function impairment. The mechanism of action in this case for why sunlight would improve cognitive function is that light may help with improving blood flow to the brain, or it may also be related to things like serotonin and other neuromodulators. How much sun exposure you get per day can be variable depending on your skin tone. The recommendation is somewhere between 5 and 30 minutes. So if you are, I always call my wife Casper. She hates it because she's very pale. Um, 5 minutes of sun exposure a day, right? Versus if you are Hispanic or African American, you may need more sun exposure to get the same benefits just because the main purpose of melanin is to fragment light. So it decreases the light exposure to our skin. Okay. Movement, just daily activity. Americans spend way too much time with their butts in chairs, right? And you've heard all the new sitting is the new smoking and all this kind of stuff. Movement is very beneficial for us, but can it reduce fatigue? This was a study in rheumatoid arthritis, another autoimmune condition, primarily affecting joints. So these are people who have chronic joint pain. And they had a control group. They gave a group a pedometer, basically a step meter, and they told them to, walk. And then they had another group where they had a pedometer and they gave them a step target goal. So the daily step target goal increased their steps by only 1,700 steps per day, but they saw the largest reduction in fatigue measured by something called a promise fatigue scale. And what they found was the more steps they increased per day, the more reduction in fatigue. So this was only a 1,700. This is not saying go and get 10,000 steps a day. I believe they increased from like 5,000 to 6,500 steps per day, something like that. Not a huge as far as time commitment increase. And they saw benefits and reduced fatigue just by increasing their steps. So there are multiple ways to get into this. You don't have to go and take long walks. Again, just break it down. If you're sitting in your butt for 13 hours straight, just get up every 30 minutes, walk around for 30 seconds, right? Even small increases in step count can make a difference. Small increases in movement can make a difference. Now, before I tell people the target is like 4,000 steps a day, you do not want to get below four. I mean, the target's 8,000 steps a day. That's kind of what I target. My floor is 4,000. Uh, there's some evidence showing the mortality benefit starts at somewhere around 3,400, depending on the person um, or the condition. But I target about 8,000 steps a day. Mindset, you got to guard your thoughts, right? And this is two things I want to talk about here: belief and placebo effects. And this is so, so strong. This is why you have to be able to guard your thoughts, to steer the direction of your thoughts, protect what information comes in your head, and protect what comes out of your mouth. So, oh, don't know why this slide is broken. So I'll have to. It looks like it should be working. I'll have to send this out. But this one, they had people do weightlifting, so they had them do 5 sets at 70% of their 1 rep maximum. They gave the people a no beverage. They gave them a clear beverage that was artificially sweetened, and they gave them a pink beverage that was artificially sweetened. There were no calories there. And the pink group increased by 4 reps compared to transparent and no beverage. Why? Because a lot of the older pre-workouts were pink. So they associated that pink, there was a belief that that would be more effective. And it was. 4 more reps is a significant amount for people who work out. 4 more reps is huge difference. What was also interesting is they looked at motivation, arousal, which is basically like excitement, affect, and exertion. And there's no difference between the groups. So the people who took the pink drink did more work and didn't feel like they did more work, all by the beliefs that they had about the drink. That to me is so exciting because it shows that our thoughts, our processes can affect our physiology. Why didn't this one show up either? Okay. Well, this is another maybe this presentation doesn't like placebo and belief effects. But this one had people, it's the famous milkshake study. So what they did was they had a milkshake and they told one group of people it was a sensible, low calorie milkshake. They told another group of people it was an indulgent, high calorie milkshake. And then they asked them how full they felt afterwards, and they measured a hormone in the blood called ghrelin, which is associated with hunger. What they found was the people who were told, and the thing is that the milkshake had the same amount of calories. The people who were told it was an indulgent milkshake felt more full. And what happened was they had a more steep decline. So the hormone that drives, one of the hormones that drives hunger, decreased faster than the group that was told that it was a diet milkshake or a sensible milkshake. So literally what they were told about it, what they believed about it, changed how they felt, and it changed their physiology. That to me is remarkable. It just shows you the power of your thoughts. And that's why it's so important to have like a growth mindset, to cultivate resilience as we go through trials and tribulations, because it can actually change the outcome at a physiological level. And this, I want to come back to this study because it talked about cognitive behavioral therapy. Cognitive behavioral therapy alters beliefs, behaviors that could exacerbate symptoms. It challenges beliefs and awareness of fatigue. It helps reorient. It helps with achieving goals, right? It can also help with symptoms like pain and sleep. So actually for insomnia, the class 1 recommendation along with medication, that I'm not going to talk about sleep medications, but cognitive behavioral therapy, very effective for helping with insomnia. And it's now easier than ever to get and do cognitive behavioral therapy. There are apps like BetterHelp, Talkspace, Cerebral, where you can go from your phone or your computer and start doing some cognitive behavioral therapy. It used to be you had to find a professional in your community. I think and the research shows that the digital apps do actually work, and they work pretty well. So I'm a big believer in what we're seeing in the digital psychiatry and psychology space. All right, nutrition. So the most well-studied nutrition plan is the Mediterranean plan, right? Mediterranean diet is probably the most well-studied diet out there. Doesn't mean you have to follow a Mediterranean diet. The principles of the Mediterranean diet, though, are great. Mostly minimally in whole foods, lean meats, lots of fruits, nuts, seeds, legumes, right? So very beneficial nutrient plan overall. This study was in COPD, another chronic disease, an inflammatory lung disease, and it showed people who went on a Mediterranean diet improved their fatigue, and they were also more independent. And this was based on a chronic fatigue scale that was developed specifically for COPD. This was in postmenopausal women, another Mediterranean diet. They measured fatigue on a subscale called RAND. They also measured energy and weariness. And they found that there was improvements in these parameters when people adhered to a Mediterranean-like diet. Another one, rheumatoid arthritis, right? This is, we've talked about rheumatoid a lot in this. And what they found were improvements in fatigue, again, with a Mediterranean type diet in people with rheumatoid arthritis. This was a meta analysis, so a study of studies. This is our highest quality of evidence. So, really, when it comes to nutrition, there's some basic principles. Diversity. So, like that picture shows, we've got fish, we've got vegetables, we've got um, uh, fruit, we've got nuts, we've got seeds, right? All perfectly well balanced, perfectly part of a whole nutrition plan. You want to make sure you don't consume excess calories. That's a great way to make yourself sick. Add adiposity that can cause inflammation. Whole foods are a lot easier to control your calories than if you're eating McDonald's every day, right? So primarily, I tell people 80% of your caloric intake, so whatever you eat, should be whole or minimally processed foods. Minimally processed is of like you buy like frozen veggies, frozen vegetables, pre-cut stuff, things like that. And there's a lot of videos we have on Life and Breath about diet. Fiber is very important for overall health, longevity, mental health. Lean meats, because it just helps control calories. If you're eating fattier cuts of meat, that's just added calories. So you have to decrease your calories somewhere else. And it's very important for our gut microbiome to have a diversity of different foods. Mindfulness. So this was a meditation study, effective mindfulness on fatigue and emotional processing. So we know people who are fatigued are more likely to experience negative emotions. So these are not positive emotions, right? And then they have decreased positive emotions and reduced task performance. This study found that a mindfulness intervention can improve emotional regulation in fatigued individuals. So if someone cuts you off in traffic, instead of flipping them the bird, you're just going to let it go, right? You're going to be able to better process and handle your emotions when fatigued if you are instituting a regular mindfulness practice. This was a meta-analysis on patients with fatigue syndrome. They had multiple different conditions: cancer, MS, chronic fatigue syndrome, fibromyalgia. They found that meditation reduced fatigue with a large effect size. They also talked about in the study how meditation's been shown to reduce pain, inflammation, anxiety, depressive states as well. So there's multiple different ways to skin this cat. I recommend 10 minutes of mindfulness a day. You can break it up into smaller intervals: 1 minute here, 2 minute there, 30 seconds here. You can do meditation. Meditation, you don't have to shut your brain off. It's not about that. It's just about being present in the moment, letting things flow through you. You can do yoga. You can do Tai Chi. I love Tai Chi. There's a lot of really interesting data on Tai Chi now for lowering blood pressure, for helping with cognitive health. Um, and it's something that people can do well into their advanced years of life. It does kind of like a mindfulness strength training thing mixed together. You can do this in breathing exercises. I love doing breathing exercises. Um, and these are all things that can be done very quickly, short amount of time. Like I said, you can break it up into small 30 seconds, minute here, things like that. Um, Apps like Headspace are great for teaching people, and Calm are great for teaching people how to do a meditation practice. Insight Timer is another one, that all of these have guided meditations to kind of teach you how to meditate. Sleep. It's no surprise that short sleep is associated with increased fatigue. I think pretty much if you're an adult, you know this, right? So this was in healthy, normally sleeping adults. So what they did was they had them increase their sleep duration by about 1.5 hours a night, and they decreased ratings of fatigue the next day. So sleep extension does help with fatigue. This was a study in adults who were not getting enough sleep, and they are instructed to increase their sleep by 90 minutes or usual sleep. And the patients who increased their sleep by 90 minutes saw more positive emotions, less negative emotions, also reported improved sleep. So they're better able to regulate their emotions when they were fatigued. That's very, very important. So, I don't have time to go into this, but at the end, there's a QR code that you can scan. I have a free, completely free. You don't have to put in your email or anything. You just download the link. I have a free ebook that talks about sleep hygiene and a lot of these other tenets of lifestyle medicine in much greater depth. Okay, a lot of people want to jump to supplements first. I would start with the lifestyle stuff first. They're going to give you much bigger bang for your buck. There's really not a great supplement when it comes to just take this for fatigue. Now, the way I view supplementation in autoimmune diseases is you have to be very, very careful because a lot of the herbal products out there can be immunostimulatory, meaning they can actually ramp up your immune system. So you have to be very careful before taking herbals. Like ashwagandha. Ashwagandha is very well studied for fatigue, has some pretty good data on it, reduces fatigue, but ashwagandha is immunostimulatory. So if you're having a sarcoid flare or your inflammation levels are high, chronically, that's not an herbal you want to be taking. Same thing with like ginkgo. A lot of these herbal products can be immunostimulatory or immunomodulatory. So that's something you want to, before you take any type of herbal, not supplement, any type of herbal specifically, you definitely want to talk to someone who knows the space very well because you could actually be doing yourself more harm than good. Okay, so let's start with the basics. General multivitamin. There are so many nutrient insufficiencies in people's diet plans, and that can happen from what you're eating. That can also happen from certain conditions. That can happen from medications you're taking. Now, is there evidence that a multivitamin can help with certain aspects of fatigue? This was a narrative review on vitamins and minerals for energy, fatigue, and cognition. It looked at things like B vitamins, vitamin C, zinc, iron, magnesium, and the role they can play in fatigue. And there are studies showing that supplementation with these things, especially in a deficiency state, can improve or reduce fatigue. This study had people take a multivitamin and they looked at cognitive function during multitasking. And so they had patients complete like a multitasking framework. And what they did was the multi group saw less fatigue and improved mood with improved task performance on two types of tasks just from taking a simple multivitamin. I look at a multivitamin like it is an insurance plan to help with anything in your diet or medications or lifestyle that can be causing inadequate intake or frank nutrient deficiencies. So, this can kind of help with the metabolic aspect. Like, again, if we're not getting enough of certain nutrients, the multivitamin, I take the one from Pure Encapsulations. I'm not associated with Pure Encapsulations. That's just the vitamin that I take. It does have iodine in it, so if you have a shellfish allergy, you may want to be careful with that. But again, before you take anything, talk with your doctor about it first. But in general, multivitamins are generally recognized as safe. Coenzyme Q10, another natural body product. Coenzyme Q10 is important for, it has antioxidant function. As we get older, coenzyme Q10 levels decline, and it is depleted by certain medications like statins and certain blood pressure medications. So this was a meta-analysis, so a study of studies. They found that it reduced fatigue in healthy and disease states: cystic fibrosis, chronic fatigue syndrome, heart failure, obesity, multiple sclerosis, kidney disease. Higher doses, so doses of like 200 to 500 milligrams, were better. The longer people were on it, were better. And it has very good safety data. Side effects were gastrointestinal. There were no higher rates of side effects than placebo groups. And previous studies showed doses, and I'm not saying to go take these doses, but doses up to 1,200 milligrams per day are safe. So CoQ10 is a natural body product, and it has pretty good evidence here saying that it does help with fatigue, probably by helping with antioxidant effect. We talked about how inflammation can cause fatigue, but also it's important for energy. It's important for our mitochondria. So it can help if there are supply demand mismatches with energy. Caffeine, old friend caffeine. Caffeine's been well studied. Some people are sensitive to it, other people are not. Can caffeine help with fatigue? Yes, caffeine improves neuromuscular fatigue, during various activities, a lot of so physical activities, especially cognitive activities. This was in shift workers. Caffeine improved attention and concentration. It decreased lapses on test performance, and it decreased the rate at which people slowed down the reaction time after a shift. And this paper, there are a lot of people demonizing coffee online. Don't drink it. Don't drink it within 30 minutes of wakening. All this stuff that's just complete nonsense. This study was an umbrella review, so it was a meta-analysis of meta-analyses. And coffee consumption is associated with reduced risk of all-cause mortality, cardiovascular mortality, certain diseases, reduced risk of cancer, certain neurological diseases, metabolic diseases, liver conditions. I would use caffeine like this. If you know you are going to do a task that is going to fatigue you, that would be the time to maybe take 100 or 200 milligrams of caffeine before that task, but not late in the evening. Don't take it, at 2 or 3 p.m. because that might keep you awake, right? But if you have something in the morning or early afternoon that's going to be troublesome, have some caffeine in your system to help with fatigue of doing that task, right? There's nothing wrong with utilizing caffeine. Now, we all have different sensitivities to it. It is a drug. So, some people may take 200 milligrams of caffeine to get the same effect. Other people get it 50. Okay. So here's a QR code. I'll leave that up there for a minute for you guys to scan. That takes you to my information. There were a couple questions here. B12 injections for those with sarcoidosis. If you don't have B12 deficiency, it's probably not going to help you, but it's also probably not going to hurt you. And it's cheap. So I think a lot of people, what they're doing is getting a very cheap placebo effect. I have nothing wrong with that. If you know you're getting a placebo effect and it helps, B12 deficiency is very easy to check for, right? So continue doing it if you're not checking. If you feel like it helps you, sure. It's probably not going to help you. What specialist is best to order these labs? Any of your doctors. You could take this to any of your doctors and say, hey, this is what I want. You are the patient. You can say, I want to check these labs. If that doctor says no, go to the next doctor. Eventually, you will find someone who says yes. Now, there are also services out there like Life Force and things like that where you can order your own labs, right? So there are multiple different ways. There are labs that you can go. We at Nimbus have a group that will go to your house and draw labs, right? So there's never been an easier way to get labs if you really want to get labs done. You may have to do a little investigating, but in the meantime, just take what you want to your doctor. Take the fatigue information to your doctor. Take the planner to your doctor, right? The relationship shouldn't be just one-sided. It shouldn't be all your doctor telling you stuff. You need to tell your doctor how you respond to your environment. I cannot help you unless you tell me how you are responding to your environment. Okay. Yeah, is there anything you can do to stave off fatigue when it happens acutely? It's seeing if there's something that you can do to trigger it. Maybe something like doing a meditation or a mindfulness, something like that in that moment can help. If you've tried caffeine and it doesn't help to some degree, it may still help to some degree. It may not get you all the way there, but it may get you through enough to do whatever it is you want to do. So it's really figuring out that trigger, figuring out what you can do. Is there anything that brings it on? And then trying some things like we just talked about to see if that helps with that fatigue severity or the limitation. And then, we talked about some supplements here that maybe like the coenzyme Q10 and the multivitamin, if you're not already doing, that might be something to consider for your regimen.
This has been super helpful, Dr. Harris. Thank you. So looking through the questions we had submitted beforehand, and I feel like you've answered a ton of them. But there are a lot of questions about like frequency or how prevalent fatigue is and its kind of connection with sarcoidosis. So can you talk about that at all?
Yeah, so I don't know of any literature on the one hand that says that specifically with sarcoidosis, but like we mentioned earlier, about 6% of people register as like having chronic fatigue, and about 40% of people, if you ask them if they were fatigued in the last 2 weeks, they would say yes. It's a very common complaint to primary care doctors. And it happens in diseases like sarcoid because of either the organ system affected or inflammation that can lead to fatigue. Now, there may be other factors, like we said, sarcoid patients tend, as far as at least men, may have lower testosterone levels, and that's been associated with the disease. So, all of these factors that we talked about, that's why we should investigate them. They can all happen in any chronic disease that I can think of. I've seen people with all of these factors affected, and then figuring out the root cause and going from there.
Thank you. Um, I know you mentioned you weren't going to talk about medications, but can you just like when they go to their doctors and they're telling them they're fatigued and they do these tests and then the doctors what kinds of things will the doctors recommend normally? And can you talk a little bit about the medications that are commonly used and I know you're talking about the holistic side, but just so that they know what to expect when they do get the results from these tests.
Mm-hmm. Yeah, so the results from it just depends. Like if you're anemic, like I said, it might be iron or B12 or folate or copper or something like that. If it's your thyroid, it would be like thyroid replacement. If it's your sex hormones, it would be a hormone replacement. If it's adrenal hormones, it might be adrenal replacement, right? So a lot of these factors were, if there were a deficiency, you just replace what that deficiency is and see if it helps. Some doctors, and I don't know how I feel about this, will use stimulants in patients who have chronic fatigue, like modafinil and ADHD medication. If I have someone and they've literally tried everything, and I mean it, you really have had to try all the other stuff, and then you cannot function, right? And you're miserable. That may be an avenue, right? But we have to balance that with the fact that it's a stimulant. We're putting you at risk for cardiovascular complications and things like that, right? So that's why I didn't want to talk about it, because those are conversations that you really have to have with your physician. I'm very, because I'm a pharmacist, I'm very careful about when and how to use medication. To me, in that situation, those would either be a temporary thing or a last ditch resort if I just have someone who just doesn't respond to anything else.
Thank you. That's helpful. I just wanted to know, like, what do they expect other doctors are going to tell them? So, okay. Then can you talk about your website, kind of like where you are now and how they can follow you and reach out to you if they would like to?
Yeah, I'm pretty active on social media. Dr. Harris MD on Instagram. The link had the QR code has all of my social medias. I don't really see patients anymore. I just provide information. That's kind of where I've morphed my career in.
Perfect. Thank you. And I will send out the link to everybody in the email when we post this. So you'll have the link to his QR code and his information. All right. Well, thank you so much, Dr. Harris. This was really amazing. And thank you for taking the time and sharing your expertise with us.
No problem. Thank you guys so much for your time and attention, and God bless you all.
Have a wonderful evening, and we'll see you next month, guys. Bye.
Bye.